Let's talk about a global health crisis that hits almost every single one of us at some point, but we're getting it completely wrong. I'm talking about back pain. Yeah, it sounds simple, but the way we're handling it has turned it into a leading cause of disability across the entire planet. But the good news, there's a really smart blueprint that's designed to fix it.
Just look at this number for a second. 54%. According to the huge global burden of disease study, that is the unbelievable increase in years that people have lived with disability from low back pain. And that's just between 1990 and 2015. So you see, this isn't just some minor ache. It's a massive public health emergency that's actually getting worse, especially in low and middle income countries. And, that really leads us to the big question we're tackling in this explainer. If we all know that spinal issues are a top cause of disability, then why is the problem growing? It's a total paradox, right? And it has massive consequences for people, for families, and for entire economies. To figure this out, we've got to break it down.
So, here's our game plan. First, we'll dig into the true scale of what we're calling the global spine crisis. Then, we'll look at the incredible shift from an old, broken way of doing things to a brand new one. We'll walk through the 8 core principles that guide this new approach, see how it actually works in the real world, and finally, we'll wrap up with why this matters to every single one of us, no matter where we live. Okay, let's dive into Section 1, the global spine crisis. It's time to talk about the real cost of this epidemic that's so often invisible and so often undertreated. So here's the absolute heart of the problem. Our current system for spine care is, a lot of the time, just reactive and super inefficient. It's kind of like calling the fire department for a burnt piece of toast. We end up overusing expensive imaging, jumping to unnecessary surgeries, and pushing treatments that don't really work. And this doesn't just fail the person in pain, it actually drains precious healthcare resources that could be helping people with other urgent needs.
So if that's the problem, how in the world do we fix it? Well, that brings us right to Section 2 and a totally revolutionary shift in thinking. This is where the Global Spine Care Initiative, or the GSCI, steps in, with a whole new way of looking at the problem.
Okay, so the first huge shift is moving away from provider-centered care and towards person-centered care. You know the old model, right? The doctor is the expert, and they make all the decisions for a patient who's just, well, a passive case to be solved. The GSCI model flips that whole idea on its head. It puts the person at the center, empowering you to be an active partner in your own healing. And it does it in a way that truly respects your own culture and your own values.
The second big change is getting away from a purely biomedical view and embracing a biopsychosocial one. The old way was obsessed with finding one physical cause, like a disc problem on an MRI. But this new approach gets that a person's health is way more complicated. It's this complex mix of biological factors, psychological factors like stress and fear, and social factors like your job or family life. It's about treating a whole person, not just the spine.
And the third major shift, moving from being reactive to being proactive. Instead of just waiting around for someone to show up at a clinic in terrible pain, the proactive model is all about prevention, catching things early, and teaching self-care across the entire community. It's about building up spinal health before there's a crisis.
Now, these big shifts aren't just random ideas. They are guided by a really clear philosophy. So let's get into Section 3. The 8 guiding principles that are the absolute foundation of this entire model. And here they are. The whole system is built on these 8 pillars. It's person-centered and people-centered, it's biopsychosocial and proactive, it's evidence-based, integrative, collaborative, and, critically, self-sustaining. You can really think of these as the DNA of a smarter, more human way of doing healthcare.
And it's so important to get that these are not just buzzwords on a slide. They are a real, practical, and actionable framework for moving us away from a system that's clearly failing to one that's effective, efficient, and actually fair for everyone.
This quote really just nails it. A model of care isn't something that happens by accident. It's an overarching design. It's about intentionally creating a consistent, high-quality standard of care that's based on what the science tells us actually works. That way, it doesn't matter where you are. You get the best possible support for your health.
Okay, so that's all the theory, but what does this actually look like in practice? That brings us to Section 4, a model in action. How does this system really deliver care out in the real world?
So the model organizes care into 4 clear levels. The foundation, level 1, is all about self-care and community programs. This is for most of us. It's about education, prevention. Level 2 is primary spine care. This is your first stop for common problems, and it focuses on treatments that don't involve surgery or drugs. For trickier problems, you get referred up to level 3, secondary spine care, and it's only the most complex and rare cases that ever reach level 4, which is for that super specialized medical and surgical care.
The real genius of this system is what's called a stepped care approach. The goal is actually pretty simple, but it's profound. Match the services directly to what a person needs, in the most efficient setting. This makes sure that people get the right care, at the right time, and in the right place. It prevents both undertreatment and, just as importantly, overtreatment.
All right, this all leads us to our final section where we really zoom out and look at the big picture, why this matters. What is the actual global impact if we start adopting this new way of thinking?
The goals here? Well, they're huge. The GSCI model is designed to dramatically reduce disability from spine problems all over the world, to stop wasting money and resources on things that don't work, and to create real, sustainable health programs that can actually grow and spread. And what's more, it lines up perfectly with the World Health Organization's vision for high-quality, people-centered healthcare.
When you get right down to it, what we're looking at is so much bigger than just a new way to treat back pain. This is a complete blueprint for building smarter, more effective, and more equitable healthcare systems, starting with one of the most common health problems on the entire planet.
And this leaves us with one final thought to chew on. We've just seen a person-centered, proactive, and evidence-based plan for a massive global health problem. So, if we can successfully rethink something as big as spine care, what other parts of healthcare are ready for their own new blueprint?